So again, from the hormonal standpoint, all of them, they have to be investigated. It doesn't matter if it is 1 centimeter or 10 centimeter. There are 10 centimeters ones that are benign. They're not like, typically it will be producing hormones when it's that big, but basically hormonal function does not depend on the size. It could be small, it could be large. Hormones have to be checked no matter what. Now, from the can we just ignore if it is small? So basically, if it is lipid poor adenoma, if it is lipid poor, it has to be monitored, because there's a lot of literature about cases of adrenocortical carcinoma that started as lipid poor adenoma that was small and then just grew, unfortunately, at some point and turned into cancer. So if it is a lipid poor adenoma, then we have to keep an eye on it. Now, how there are experts that also recommend surgery even at smaller size than 4 centimeters, especially if the baseline density is very high, then because the risk is also high if the baseline density is very high. And we don't have very good exact guidelines of monitor them for 10 years, monitor them for 5 years. We don't really know. If it is a lipid poor, I would say until we have better guidelines of when to stop monitoring, then we have to keep an eye on them. Now, if it is a lipid poor adenoma, but we have a CT scan from 10 years showing that it was stable, basically the same size, then this is less concerning for us. But again, any nodule has still to be checked from the hormonal standpoint.